Hi, everyone. For those of you that don't know me, my name is Rubina. I'm an academic recruiter with Aspen Dental. Aspen Dental is a DSO, a dental support organization in which Aspen Dental Management, who I work with and work for, we support over 800 offices in which we're helping out our dentists focus on the main things that they need to focus on, which is patient care. We're here for recruitment needs, marketing, business development, all of the other side things that doctors don't really want to focus on since patient care is their number one. So today I have Dr. Andrew Brown with us, and we're going to go through an Ask Me Anything session. And so there's a question and answer box on the bottom of your screen. So feel free to type in any questions you might have, and I will be the moderator and go through them and ask them to Dr. Brown. The questions for me, I have two screens. They're going to appear on this screen. So if you see me looking this way, it's not because anyone's there. It's because there's another screen and I'm just focused on looking at all the questions that you've been asking. If you do have any questions that you want to ask privately, feel free to email me and I can answer them on the side. So again, the question and answer box is on the bottom. So without further ado, Dr. Andrew Brown, if you could introduce yourself.
Hi, everybody. My name is Dr. Andrew Brown. I am a new graduate. I have been out of the University of Michigan for about 5 months total now. I have been with Aspen since the beginning of June. I've had a really excellent experience so far. I am practicing in West Michigan, Muskegon office to be specific. I'm working for an owner of a few practices. It's been a really excellent experience, learning a lot about the business side, learning about the clinical side, advancing my skills and the things that the University of Michigan helped me to learn. And been having a lot of fun so far. Looking forward to answering any questions that you might have, whether it be about how my education got me ready to go and practice with Aspen, what my experience with Aspen's like, personal life, whatever it might be. So ask away.
So we've had a couple of questions right off the bat. So what options did you look into coming out of dental school, and why did you end up choosing Aspen Dental?
Yeah, that's a great question. So what options did I look into? First of all, I weighed a couple of different options. Before I went to school, I gave a lot of consideration to the Armed Services HPSP program, I believe was the acronym for it. I did not end up going that route for a number of different reasons. So that was the start of my journey, that once I decided I wanted to go to the University of Michigan and then be able to forge my own path rather than going into the Army Services. It is an excellent opportunity for people who want to do that. I decided it wasn't for me. So as I was getting ready to come out of school, we were starting to decide, my wife and I, where we wanted to live. And so that was the first thing we had to decide, right? There would be different areas around Michigan. We decided we want to come over to the west side, live in Holland area. And so I looked at private practices. I looked at community health clinics. I looked at working for the state of Michigan, actually within the corrections department, because I have one of my best friends who works for the Department of Corrections as a dentist for the DOC. And then I looked at DSOs like Aspen and weighed all my options. I had some conversations with different doctors, learned about pros and cons of each option, looked at opportunities that were available between some of those private and DSO, whether it be community or working for the government. And I was, to be quite frank, at the right place at the right time, that the doctor that I'm now working for was looking for somebody at the time that I was looking. And we had a few discussions. It seemed like a very attractive opportunity for me to come out of school, learn a lot, be able to pick up my clinical pace by a pretty significant margin. And after just weighing out all the pros and cons, I thought that Aspen was really the right fit for me. And I'm sure that there's going to be a few more specific questions coming up about why exactly it was the right fit for me that I'll be happy to get more into. But I did weigh all of the options, whether it be a private community setting, working for the Department of Corrections, and working for a DSO. Look for a lot of different options.
Perfect. No, thank you. That was great. Someone asked, along with that, what types of contracts does Aspen Dental offer for their general dentist? Did you go through a contract? What was your experience starting with Aspen?
Sure, absolutely. So I can speak for general principles of what was explained to me with a recruiter, and also a little more specific for my situation and my owners group situation. So I started working with a recruiter with Aspen about 2 months or so before I graduated. So it was about March. I was starting to narrow down my options a little bit, and they were explaining about what the process looks like, what different types of contracts are. And so basically, in a very short process, Aspen has a couple different levels of dentists, right? So start out as an associate dentist, work your way up to a managing clinical doctor, which is what I am. And then if that's something that you're interested in pursuing for the long term, even further, you can look into becoming a practice owner. So I started out as a associate doctor in the beginning of June, which was an excellent experience. What that basically means is I was basically working under my owner doctor's treatment plans, at least to start right off the bat, right? So for that only lasted for about a week or a week and a half, to be totally frank with you. So what that meant is I started out with my own column of production. So I was seeing extractions, I was seeing crown and bridge, seeing denture steps here and there, and seeing a lot of fillings. Okay. And so really quickly, my owner doctor decided that he wanted, for lack of a better term, to kind of put me on the fast track towards working towards a managing clinical doctor. What a managing clinical doctor does is they're the doctor who is doing new patient exams, creating a treatment plan. They are seeing the procedure columns. They are seeing the overflow columns. They're really managing the day-to-day flow of the office. And so part of my owner doctor's progression, how he wanted me to progress from the associate up into managing clinical doctor, is he started right away with having me see new patient exams. Like within my second week, I was seeing new patients, jumping into overflow to do denture steps, taking on as much production as I could handle so that I could very quickly become, as quickly as possible, become a managing clinical doc, which is very exciting. And it made me feel pretty good that he trusted me enough coming out of school to be able to take on more and more responsibility. And it was a gradual process, certainly. I didn't start out as an MCD on week number 2. It certainly took me some time to build up to the point where I felt comfortable taking on the responsibilities of that office. So going from the contract of an associate dentist up to a managing clinical doctor, of course, does change a little bit, both in responsibilities and expectations, and also from a financial compensation and benefits package. And so I think that those vary a little bit between different practice owners. So it's difficult for me to make a blanket statement about those. But I spent about 3.5 months as an associate dentist before moving up to managing clinical doctor at the beginning of this month. So I'm now, when I was first there, I was working under a contract with my practice owner, and he was there in the office 5 days a week. After about a month, he started scaling it back a little bit to 3 days a week. And then in September, he was basically there 2 days a week, and now he's there 1 day a week because he has multiple offices and he's kind of rotating around those offices and getting to see all of his offices, hoping at least 1 day a week. So that's where my next step in the contract jumped up to managing clinical doc. So I hope that answered your question.
Congrats. Yeah, no, congrats. I'm just going to elaborate a little bit. So with Aspen Dental, a lot of DSOs or even private practices, they like to say contracts, but with Aspen Dental, we don't have contracts. We have letters of agreement. So it's not binding you to us for any duration of time. There's no, you don't have to stay for a year or 2 years or anything like that. But like Dr. Brown was saying, There are different letter of agreement when it comes to being an associate to a managing clinical director, which is a lead dentist, like he explained. So your profit sharing increases, and it really does depend on each office because all of our offices are owned by Aspen Dental doctors, practicing dentists. So since it's their babies, their offices, they get to choose a little bit on what the percentages will be. But overall, we like to say most Aspen Dentals are fairly the same. We like to have just a standard of what we like to offer our associates or managing clinical directors when it comes to salary and everything like that. But there's nothing that binds you. If you, for any reason, want to leave, you can open up a practice right next door if you'd like to. So there's no confined statement or anything like that. So that's a really big plus.
Yeah, that's a very crucial point. If I could add just a little bit on
Yeah, no, go ahead.
in the differentiation in between a contract and, like you mentioned, the letter of agreement, right? So the contract, oftentimes contracts, if you're breaking down the difference in a contract between a private practice and somebody like Aspen, when you sign a contract with a private practice, very often one of the major things that you hear about in dental business classes is the non-compete, right? So that means, should I have gone out of school and I had started at a private practice down the street, they'll often say, for 2 years, this is for example, using during general numbers, for 2 years, you may not compete within a 5 mile radius of this office, right? And so now those sometimes can be negotiable when you're creating that contract, working between the owner doc and yourself. But it's very important to know, like you had mentioned, that Aspen does not have a non-compete like that. It's a letter of agreement.
Perfect. Thank you. Yeah. Um, Going along with that, I know you had mentioned your treatment plans when you first started as an associate to now being an MCD. Is there a dictation of your treatment plans? Because I know you said that they had helped you when you first came out, or you were following those. But do you have full clinical autonomy? How exactly does that work?
Yeah, that's a super, super important question, because I think that's one of the greatest misconceptions about some DSOs, or maybe even Aspen in particular. Because I think that a lot of people who don't really understand or who haven't really seen it first person might think that there is a dictation of treatment plans, that there is a dictation of the way that we run the business, allowing finances or allowing the administration to dictate the way that we treat our patients clinically, which, after being here for 3.5 months, I can firmly say has been nothing further from the truth. Anytime that I've had any type of discussion about administration or finances with some of our managers, they are very, very, very clear to make sure that we are not changing the way that we are clinically treating our patients, right? Because that if we allow anything to get in the way of treating our patients with the utmost level of the highest level of care possible, then that's just flat wrong, right? Because we are ultimately here to serve our patients, not let anything serve ourselves before we serve the patients. So no, there is no dictation of treatment plans. There is nobody telling me you need to prescribe, 7 root canals a day or do X amount of crowns per day. Every office is different because every office serves a different patient population. Every office has a managing clinical doctor, an owner doctor, or associate doctors who have different interests or different things that they believe in clinically. And so it's really not a one size fit all. Does Aspen work with us to help us manage the business as effectively as possible and make it run as efficiently as possible? Absolutely. Sure. But there has never been, for me, in 3.5 months, any dictation of treatment whatsoever.
Wonderful. Now, with that, is there ever a competition or I guess competition is the right word for getting a certain type of treatment. So when you were an associate, if you had just done fillings and, your MCD or the owner doctor that was in the office, he or she kept doing like the implants or the big procedures. Was there ever a competition that affected like how you were paid or production or compensation or anything like that?
No, there's not. And that's a really important point because it's a little bit different than some other practices, particularly with private practices. Because when you look at contracts with a private practice and look at private practice ownership versus associate doctors, can often be a huge sticking point for those doctors within their relationship in the office, right? Because of that level of competition, because of the way that they are compensated based on what they're producing. And within my office, and to my knowledge, the other Aspens as well, if I can make a near blanket statement, it is not, basically, we are compensated based on the profit loss statements of the office, right? And so we are working as a team to produce as efficiently as possible, and managing clinical owners, managing clinical doctors and associates are compensated based on the team's effort and the team's production rather than individual. So there isn't a competition. When I was an associate and I was working with my practice owner, who was effectively the MCD at the time for those 3 months that I started as an associate, there was never such a thing as like, I want to prep that crown because I want to be compensated for it individually because I know that I will be if I do it. There were plenty of times where I would prep a crown and then he would seed it, or vice versa, because as long as we are effectively treating the patient and giving them the highest standard of care possible, and it is contributing to our bottom line in the office as a whole, we are working together as a team and will be compensated appropriately as a team based on your level of seniority, like you mentioned.
Right. And, along with that, hygienists too, their production is involved. And then our offices, a lot of them have oral surgeons and endodontists that come to the offices. So, which is really nice for the patients. They don't have to find another office to go to. It can be the exact same one because it's traveling. But their production as well helps with the bottom line, which helps with your bonus at the end of the month. So
my oral surgeon, or my practice's oral surgeon, will be in our office tomorrow, actually, and our endodontist was there last week.
Awesome.
So yes, like you mentioned, it is contributing to the bottom line of the office when even the oral surgeon is involved with that compensation structure.
Right. So speaking of specialty and, different types of procedures, I just had the question asked, if I work for Aspen, directly after I graduate, will they teach things like molar endo, surgical extractions, implants? They continued with, I feel ready to go into practice, but I feel like what's taught in dental school is pretty basic and I really want to learn more advanced techniques.
Yeah, absolutely. So I'm taking a couple notes here just so I can address each of, in a real short, each one of the questions that you had. I think you said molar endo, surgical extractions, and implants. So yes, absolutely. Because I felt very much the same way as you did when I came out of school. I felt like, for example, like you brought up surgical extractions. I know that a lot of dental schools limit the surgical extraction experience that you can get as a whole. Obviously, that's not a blanket statement. Some give more than others, and then even within certain schools, there are opportunities to get more extraction experience with surgical techniques. I can say from my experience, I feel like I was in the same boat as you, particularly with the surgical extraction, because I didn't get a ton of experience with it. So coming into Aspen, this is one of the really awesome experiences. One of the great things about the way that my transition period worked is I was working with my practice owner, and he, being in the office 5 days a week, anytime I had a clinical question, he was more than willing to help me out. And there were more than a few times that he jumped in and hopped in on the procedure and helped me out, particularly with surgical extractions if something got a little bit tricky. So surgical extractions, yes. My doctor does a lot of them. We're pretty extraction heavy in our office, just because of the population that we serve. So we get a lot of chance to practice that. He taught me a lot. When it comes to implants, yes, we have a whole set of several courses, all the way from beginner. I don't know the first thing about implants, all the way to doing all on four fixed prosthetic implant courses, right? So what does that mean? Means 2 weeks ago on Friday afternoon from 3 to 6 and Saturday from 9 to 5, I was actually on a Zoom call with Aspen's implantologist, our leading implant doctor within the corporation. And I can kind of go into that a little bit more in detail if that was a specific question, or if you wanted to reach out to me and I can explain how that works a little more. I don't want to burn everybody's ears out if that's not the specific topic of conversation. But yes, there's a lot of opportunities to progress your experience and your knowledge base based on CE courses that we have within the corporation and also outside. And we have opportunities to be able to learn a lot more, whether that be, like I said, within or going for outside CE. So
Wonderful. Thank you. With the CEs, we provide I basically all the CEs you'll need. But if there is anything outside of it, you can talk to the owner doctor and see, if that's something they'd be interested in sending you to, if it's outside of our scope for any reason. But I think we pretty much cover a lot of the categories and topics.
And if I can add a little bit to that as well, kind of within the network, and this is something that I can only speak for my practice owner and his group. I can't speak for a whole lot of other Aspen offices because, like I said, I'm relatively new to the company, so I don't know that many other practice owners and what their structures are like. But speaking from my experience, my practice owner owns 5 offices, and so he has 5 MCDs, multiple associates who are working with him. Now, each one of those doctors, of course, does have different experiences, different things that they are skilled in, and different things that they're interested in. So that gives me a whole range of, it gives me a group of people that I can reach out to when somebody's strengths are different than mine, and I need to tap into those person's strengths. Example, I had a patient come in recently who needed a new crown, an EMAX crown on tooth number 9. They were looking for something extremely aesthetically pleasing because they had high aesthetic demands for their restoration. And so I was able to go to one of our other owner doctors within my group to kind of tap in and say, hey, this is what the patient's goals are. Here's the clinical situation. Can you provide a little bit of guidance to get us to where we need to go? So they can either help me out, which this doctor did, one of the other managing clinical docs, pointed me in the right direction for some resources, but also give me insight like, hey, this is how I learned this. This is where some of the CE courses that I got the information from might be something that you're interested in. So
awesome. Yeah. Good networking opportunities with Aspen Dental and everything.
It is.
If anyone's interested, it's aspendentalce.com. We're offering free CEs until the end of the year. So feel free to explore, create an account, and, learn. So I had a student just ask, how does Aspen, or I guess, you working, manage situations where a patient needs retreatment and you weren't the original doctor that saw the patient? Are you still obligated to do the retreatment for no production, assuming the original doc isn't in the office that day? I don't know if you've had that situation. If not, I can totally find out the answer to that from someone else.
So I guess I don't have a ton of experience with situations that exactly fall into that question. What I can tell you is this, is that if it were, I do have quite a bit of experience with is for retreatment between 2 doctors in the same office, right? Which does happen. An example of that is if you do a big extract and insert case. So somebody has failing dentition, they would like all extracted on one day and they would like a denture that day. If you've ever done that, it can be an excellent treatment option for the patient. And sometimes from an aesthetic standpoint, it can be very challenging to create a final restoration off of that denture, right? Because you are, for a lot of variables, it can be very challenging. So I have run across situations where my practice owner did an extract and insert case with an immediate denture, and 6 months later, when the patient's finished healing, they came back and they said, hey, I was not originally scheduled to get a different denture to replace this one, but I'm not happy with the way that it looks. My owner doctor and I firmly believe that we want to stand behind our product and we want to serve every patient with only the highest level of care, right? And so if a patient comes to us and says, hey, I'm not really happy with this product, but I'm willing to work with you to make it right, we're very absolutely happy to work with them to fix it, to retreat it, right? So what does that mean? Oftentimes means making a new denture. So what does that mean for me as a managing clinical doctor for a doctor that's not in the office anymore? Essentially doing a retreat, to answer your question, to make a new denture. To me, that's something that we absolutely do on the regular. If it is something between Aspen offices, meaning I had a patient that came and they were a little bit unhappy with their denture, but that was made in Florida and I'm in Michigan. That becomes a situation that I cannot speak on because I've only had it happen one time. And I don't have a lot of experience in exactly how situations that are resolved. I would say they're not common that something like that will happen. Have I seen it? Yeah, I've seen it once. Where somebody was treated in Aspen in another office, and they come to see me, and we figure it out. We work with our managers. We work collaboratively with the team from that original office, and we make it right for the patient. The end result was we made it right for the patient.
Yeah, patient care is number one.
Yep.
Even with our profit sharing, at the end of the day, when you're looking at the profit and loss statements for your bonus at the end of the month, it's based on patient satisfaction scores. The office might do wonderfully, but if for any reason you aren't, focusing on patient care, the bonus won't be as great because we want to emphasize patient care is number one. So, yeah, just wanted to add that.
Yeah, and it's very important to us, and it's something that I am proud of in my office. My owner doctor is proud of is that we have a very high patient satisfaction score because we stress that we're going to do right by the patient. We're going to make the patient, we're going to treat that every single patient fairly and do the thing that's right for them.
Wonderful. Thank you for that.
Mm-hmm.
So what advice would you give a dental student to be prepared coming out of dental school, especially, with speed, treatment plans, keeping up with it all? It seems a little overwhelming.
I'm just jotting down a couple of notes here.
No, you're good. You're good.
Thoroughly. So advice for coming out prepared. So I'm not sure exactly what level of education you are in. If I'm guessing, maybe you're a fourth year, right? Or this really can apply to anybody. I would say my number one piece of greatest advice is jump in and get absolutely as much clinical experience as you possibly can. If you want to go into clinical dentistry, because not everybody does want to go into clinical dentistry, right? Some people want to go into research, some people want to go into education, and those are great. I wanted to be a clinical doc so I could speak from the clinical perspective. If you want to be a clinical doc, know what the things are that you are interested in doing and throw yourself in and get absolutely as much experience as possible. But on a note, on that point, don't just get experience in the things that you are interested in doing. Get as much experience in the whole field of dentistry. Do things that you don't necessarily want to do. I'll tell you the truth. When I came out of school, for a long time while I was in school and even coming out of school, I struggled with extractions. They were not my strong suit at all. And I wasn't really afraid to admit that. But that just means I had to throw myself in harder to get to learn how to be more skilled and proficient and efficient in extractions, whether that be simple or coming back to the point that somebody asked a few minutes ago, doing surgical extractions, and how do you learn to become more educated in those? So just throw yourself in. In fact, just a few minutes ago, my best friend texted me from dental school. My best friend from dental school is, I look up to him because he threw himself in more than anybody else that I know, getting as much experience as possible. We used to call him the Prophy King because second year he was booked out for like 2 months straight doing just straight Prophy exams because he threw himself in trying to get taken every patient experience that he can. So that's what I would encourage everybody to do. Do the things that make you feel uncomfortable. Do the things, and I don't mean like doing something wrong. I mean like the things that you struggle with. Like for me, extractions. I did as many as I could to get better at them, and also keep an open mind, because I think that I think this is a really important point too, that a lot of times when people are coming out of school, they have expectations that they are going to only do a specific type of dentistry, whether that be cosmetic dentistry, whether it means they're going to be doing a lot of molar endo and a lot of implant placement. And that's not necessarily going to be the reality for a lot of people coming out of school for a lot of reasons, right? You're inexperienced relatively compared to other dentists in the field. Um, from a speed perspective, you're not super proficient. Um, and a lot of people are coming out with student loans and you have to pay those student loans off. Unfortunately, that's just the reality of the market that we're living in today, right? So you have to figure out a way to pay those off. So just have an open mind, be ready to jump in on all the things that make you feel uncomfortable, because you're going to get better at them. You're going to feel a lot better at them with time. And you mentioned proficiency and being quick with procedures as well. It's an important skill. And going back to what I just mentioned, there's no way to get more proficient and efficient other than just doing it over and over and over again. And I think that's one thing that my experience has been great for. I've had a lot of opportunity to just jump right into a lot of extractions, a lot of fillings and crown preps and denture steps. So, and that's helped me get faster, because I used to tell my closest friends in dental school, I used to tell my wife, I was so embarrassed for so long in dental school because I felt so slow. And that's okay, because in school they taught us to be skilled and to do it well before you can do it fast. It's important to do it well before you do it fast. So it's okay to feel a little bit slow for a period of time. The speed will come. Make sure that your clinical skills are there and the speed will follow. Okay.
Awesome. That's great advice. Thank you for that. Um, going along with that, what does it look like for new grads starting at Aspen? Did you have a good experience? Did you feel supported?
Yes. Do I feel supported? Yes. Supported. And I'm sorry, what was?
Did you have a good experience, and just what was it like for you starting? And I know
Yeah,
you had a different situation, with COVID and training and all that stuff.
yeah,
But
yeah, super important.
Yeah.
Because what was the experience like? I was really nervous. I was very nervous for a whole lot of reasons. Coming out of COVID, the COVID shutdown, I started 1 week and change after Michigan offices were allowed to reopen, right? And so what did that mean? Everything was in limbo. Everything was in doubt. Everything had changed. The market was so different than what I understood it to be before I came in, right? And so many things had changed with like the unemployment. And so what does that mean? We had a lot of patients whose treatment plan got put on hold. Which means that treatment plans got shaken up pretty significantly. We had to treat a lot more emergencies than we used to. Even our staffing in the office was different for a period of time, right? We lost some people. We had some people leave the office. We had some people that didn't come back after we ramped back up into full-time production again. So it was, and this is a little bit more speaking to what it was like coming out during post-COVID pandemic shutdown. It was rocky for a little bit. I was pretty nervous. I used to come home and I was just like shook a little bit because I was like, man, today was crazy and I don't know if I can handle this. But it got better, and we honed our team and we hired more dedicated people back into the team. We built a team back up, and I felt that like I started to get a lot more comfortable with the pace of seeing the number of patients that we do in a busy office, and just being able to be proficient in some of those experiences and some of the procedures that I was doing. So did I feel supported? Absolutely. I couldn't have done I couldn't have made the transition that I did without having a couple key people. One was my practice owner that I've gone back to a few times. He's been amazing. I've learned so much from him over the course of only 3.5 months already. Aside from him, I've also had a lot of support from my office manager, because all of our offices have office managers, at least within my practice group. I'm not saying the Aspen group as a whole, but within my 5 offices, everybody has an office manager. My office manager is really, really amazing. She's always been extremely supportive of me, even the good times and the hard times. She's always very supportive. Our regional manager that helps out with all of our offices, and then our territory manager as well. So did I feel supported? Absolutely. And reassured that like, hey, things are going to get better. Things are going to get back on track. Things are going to feel more smooth. So To be honest with you, as a whole, I have really had nothing but a positive experience and nothing but great things to say. And I don't want to sound like I'm giving a really unbiased opinion, but now that I feel like we're starting to really hit our stride, we've got a really well-built team that we've built, skilled team that we've built, dedicated team that we've built up now, that comes to work excited to treat our patients every day, that I'm feeling more confident, that my owner has given me more responsibilities and more trust to be able to do the things that I want to do within the office. I've had an excellent experience so far with Aspen, for sure.
That's awesome.
Yeah, thank you.
We usually do have like a whole training program, where we send you to Chicago,
Yep.
all that good stuff. But with COVID, things are delayed, but I'm so glad you had a good experience with.
Yeah. So mine was a little atypical, if I could say something real short on that. It's just, I know you, like you said, a lot of times when you were hired into with Aspen, they will send you to Chicago for this whole training course. And I think it's like a week long, if I remember correctly, hearing about it. Mine was different because we jumped in right after the dental office shutdowns and before any of these courses in person have started again. So I did take some courses online on Zoom, just like we're doing right now, to kind of supplement for the lack of those courses. And to be frank with you, once they start again, I doubt that I'll probably end up doing those because I will have already been in the practice and up to speed by that point. But normally there's a lot of in-person training that goes on to make sure you really feel supported and up to speed with practice before you jump in too heavily. And even within the clinical practice of what I was doing on the day-to-day, they made sure that I felt comfortable before I took the next step up. I was never forced to jump into anything that I wasn't ready for. I was never forced to jump into handling more patients than I could handle. My owner doc really did an excellent job at making sure that it was a smooth ramp up for me.
Wonderful. That's so good to hear. Now, do you do all procedures or some procedures? Do you have that flexibility?
Yeah. So I really have the opportunity to pick and choose what I want to do. Now, what does that mean for me? Knowing the patient population we serve, I don't have, if I were to say I'm going to turn down doing these simple extractions or a relatively straightforward surgical extraction just because I don't necessarily want to do it or I'm not necessarily comfortable with it, probably wouldn't make a whole lot of sense for my business as an MCD in my office. Now, my owner doc has made it clear from the start that I can take on the things that I am skilled in and ready to go to do and things that I want to do. So he says, if you want to do endo, go for it. If you want to restore implants, absolutely. If you want to place implants, let's get you on the path to do that. Let's get you on a path to be doing Invisalign with our Invisalign team within the Aspen Corporation. I only do things that really, really clear about this. I only do things that I feel comfortable in doing and things that I do want to do. So I don't regularly do endo. That's not necessarily because I don't want to or don't feel comfortable with it. It's just our office, we don't do a ton of endo in our office. We do more extractions and removable, to tell you the truth. So that's something I'd like to get a little bit more into so I can do some more bread and butter. And again, feel very supported and ready to be able to do that when I want to make that jump in some cases become available. Excellent example is third molars. I mentioned a few minutes ago that our oral surgeon is going to be in my office tomorrow. So any third molar extractions, particularly partial bony, full bony, are not something that I personally have an interest in taking on. It's never been something that I particularly enjoy, taking out third molars, especially ones that are really challenging, or especially ones where the risk of complications higher. We're talking about, inferior alveolar nerves, close to the sinus, anything like that. I have full autonomy to refer that to my oral surgeon to take it out more comfortably because it's not something that I want to do. It's not something I'm skilled in, trained properly to do. And I don't think that for me to jump into that procedure, being unprepared is a good service to the patient.
Awesome. Thank you.
Mm-hmm.
What does a new dentist find frustrating? It's pretty
What does a new
generous.
patient or what does a new dentist find frustrating? One that I deal with on a pretty regular basis, the first thing that comes to mind is dealing with patients with unrealistic expectations. And what does that mean for me a lot? It means, unfortunately, it means dealing a lot with a patient that has to go into a denture and is not quite ready for that. So patient communication is absolutely critical. Being able to work with patients. I have absolutely seen the value of being able to communicate clearly with a patient before they begin treatment. So that for me, a new patient exam is so critical for me. I try to make sure that I build in an appropriate amount of time, especially if we're talking about more involved procedures like extractions, like dentures, whether they be complete or removable. Anything that's more involved in like a straight filling or a simple extraction, I make sure to sit down the patient and make sure that they have very clear expectations about what they need to know about their upcoming treatment. Because there's not much more that's frustrating than a patient who doesn't like a denture that is well made and well adapted to them and is a good denture for them, but they're just not, that they are not quite ready for that. You know what I mean?
Right.
So dealing with angry patients also is can be a little bit frustrating. People that are unreasonable. The reality is with any business that you're working with people, that's going to happen, right? My goal is to put that patient first, give the patient the best experience possible, and make sure that they are happy with the treatment. They feel like they've been treated very fairly. Great example, very short story. We delivered a pair of partials today, this afternoon, for a patient who was unhappy with her partials that we delivered to her. And one day she came into the office and she was a little upset with us. And we worked with her and we said, what can we do to make you happier with these dentures? What is it going to be that you feel like you've had a good service from us? And she said, I would like a new pair of dentures. And for these reasons, these 3 reasons. And we made her new dentures and we sent her home and she was happy as a clam when we sent her out the door today.
Oh, wow. That's great.
Yeah. So that one felt good when we dismissed her today, for sure. Or we finished her today's appointment, I should say, to be clear.
Yeah.
Yeah, that one felt good. But frustrating is just, I guess it's the first thing that comes to mind.
Yeah.
I think the other thing that it can be frustrating are things that just very, very challenging cases that can be a little bit out of your control. I tend to be somebody who puts a lot of pressure on myself to give the patient the best experience possible. So if something doesn't go right, even if I know that I gave it 100% my best effort, and it's still, and that's life, right? That sometimes things aren't going to go exactly the way that you plan. I struggle with that, but I think that I've learned to make sure that procedures go right and procedures go as planned more often than not, and also deal with them when they don't. You know what I mean? So
Definitely.
that's a challenge for me, and I know it's a challenge for a lot of dentists because we tend to be type A perfectionist personalities.
Right. So you talked about, explaining treatments to patients and having them understand and everything. When you treatment plan, are you going through finances and all of that stuff? How does that work?
Yeah, super crucial question, because that is one of the most, that's probably the second most commonly question asked when I'm in my office, right? Like if I have a discussion with a patient, they come in with terminal dentition and they're going to need extractions with a denture or a pair of dentures, right? I will give them a spiel that I give every patient that needs extractions and dentures, because that's what I found works for me to communicate effectively with patients. And I say, what questions do you have for me? And one of the most commonly asked questions, what's it going to cost? The financial side of the business is complex with insurances. I find that I am not well suited to thoroughly understand the insurance business, the insurance side, and the clinical side. And that's one of the amazing benefits of working for Aspen, is that I feel supported and that that's not something that I have to do on the regular, is working with the insurance and giving patient the financial aspects of their treatment. So here's what I say to that question. When somebody says to me, how much is my denture and extractions going to cost? And I say, that's a great question. And I am not the expert in the finances and insurance side of it. But I'll tell you what, we're going to take you out to our treatment coordinator right now. I'll walk you out there right now and I'll introduce you. Her name is so-and-so, and she is going to take a look at your treatment, answer questions you have from a financial side, and give you a rundown of what every option that we provided for you is going to cost. And we can come up with a game plan together, because it's not something that I'm well educated and well versed in, the financial and the insurance side of it. And so I tell the patient that straight up. This is not my strength. I do the clinical side of it, and I leave that to the experts of their field. They let me do the dentistry, and I let them do the financial side.
Right. No, that's perfect. Perfectly answered. Just like I said, in the intro, ADMI, Aspen Dental Management, Inc. is here to support the dentist, to have them focus on patient care, which is their expertise. So we don't get involved in that. And, we try to help them and support them as much as possible so that they can just focus on that. So thank you for answering that.
Yeah, of course.
Now, you talked about your owner, Doctor.
Yeah.
Is that your mentor, or do you have a side mentor through Aspen? And, when you first started, or even now, do you still speak to them? Are they easy to access?
Yeah. So I would say that he is my primary mentor on the day-to-day basis. I probably talk to him at least 3 days a week when he's not in the office. So I didn't see him at all last week, actually. Because like I said, he's only in my office once or twice a week at most, and he happened to be out of town last week. So I was still on the phone with him at least 2 or 3 times, like I said, whether it be text or a call, and whether it be a clinical question or a business question, or how should I handle this situation. That doesn't necessarily mean what should I do in this clinical situation, but how should I manage a personal situation in the office. So I don't have a side mentor in Aspen. I would say that I have mentors outside of Aspen that are just totally separate because of people that I've met along the way to becoming a dentist. But my practice owner is somebody that I reach out to. He's really excellent at always either picking up the phone right then and there, or he'll call me back within 15 minutes at most, always. So he's very reachable. He is always very helpful to any questions, because he has the same goals that I do. I would say we're pretty well aligned in the things that we want from our business and our patient care.
That's great. That's awesome. So I just had someone ask about choosing a dentist or which office to work for. So they said, because during the interview process, you can't really know if their working style is similar to yours. And you might get more of a sense of that once you start working with them afterwards. But how do you really figure out what office is right for you before you commit?
That's a super good question. How do you figure out what that office's style is like before you commit? I would say a crucial way of doing it is talk to the assistants and talk to the office manager, and talk to, if you know any patients that worked in that, or excuse me, patients that went to that office for their care. Ask them about their experience. Ask them, was it a positive one? Was it a negative one? Why was it positive, or why was it negative? Do you feel like you were being sold on treatments that you didn't want or didn't necessarily need? One thing that you need to know is, or one thing to kind of gauge that is this office doing procedures that you feel comfortable with? I mean, relatively comfortable with, like we touched on a while ago, relatively comfortable in doing, and that you want to do. If I was trying to jump into an office at this point in my life, and I was doing a lot of molar endo, and I was doing a lot of third molar full bony extractions, and a lot of really cosmetic veneers and such, a lot of full mouth reconstructions, and if a doctor said to me, yeah, this is what my office really specializes in, then right away, this is not the things that I am skilled in, proficient in. These are maybe not the things that I want to do. You need to have realistic expectations for yourself. Is this going to be a good fit for me? And so I think it comes down to communicating with that doctor. What do you like to do? What does your office do a lot of? What's the day-to-day office flow look like? What kind of procedures do you do regularly, and which ones do you specialize or you refer out to specialists commonly? Is the best way that I think I can put that
Yeah.
one.
No, that's perfect. And then I would go on top of that if the office allows for shadowing. And do you, Dr. Brown, allow for shadowing, or do your offices? Do you know?
Sure, I would imagine so. I've never
Yeah.
had anybody ask to shadow me. Um, Not to say that things like that don't necessarily happen in my office. We actually partner with a dental school to have externs rotate in, which is cool. And we had
Awesome.
one in the month of September, and I think we got one coming in November as well. And so it's a little bit different than shadowing, of course, because the extern is getting hands-on experience. They're the ones doing extractions and fillings and crowns and bridges. They were doing SRP. My practice owner really put them to work. What he really wanted to do is get as much experience as he could while he was here. But for shadowing, sure. I mean, if somebody said to me, hit me up right now and said, "Hey, I see that you're, a dentist now. I'm really interested in the field. Can I come shadow you?" As long as that's something that is appropriate and approved by my practice owner and my office manager, which I don't expect would be a problem at all. Sure, yeah, we'd be happy to have somebody come
Yeah. Yeah.
shadow me. I've never had it before.
Yeah. Let's make one of you guys the first one.
Yeah.
With equipment and supplies, do you get to choose what you want? How does that work exactly?
Yes, there's so many good questions. Yes. And I'm not just saying that like trying to, spice up the conversation. No, it really is. The reason I say that's a good question is because I was trying new materials today. Aspen has materials that we generally work with because we can get them at a good rate. Today, I was trying a new composite because we've been using a composite in our office for some period of time while the owner doctor was working as the acting managing clinical doctor. When I came into the office, he told me on day one, literally day one, if there's any materials or anything that you need to buy, you let me know. We'll order them up for you because ultimately it's about the patient care, right? And so we need to have what you need to work effectively in patient care. So we've made a couple switches since I have been taking over the office full time. He's been stepping back from working in the office full time. And some of the PBS impression materials we used. I was trying out new composites today that a rep brought and dropped off at our office last week that I really liked. And I can tell already that it's probably going to be a switch that we're going to make over the next few weeks, jumping into this new composite. And so, yes, we have full control over what we want to use in the office. I do think it's important to have flexibility and to learn new things because I'm assuming that everybody on this call right now is a dental student or an aspiring dental student. And it's important to know that when you come out of school, there's going to be a lot of materials and techniques and skills that you've never had exposure to at your dental school or within your externships. And so don't be closed-minded and say, I've never seen this before, so I don't want to use this at all. No, give it a shot. For me, what that meant is I've been using this composite that we had in this office for 3.5 months. I've learned after 3.5 months, it just doesn't, I don't love the way that it works in my hands compared to other composites. So we're making a change and it's great. And my doctor has absolutely no problem. My owner doc has absolutely no problem with that. He said, yeah, if that one works better in your hands, if you like the outcomes that you're getting more with that one, it's giving you good longevity, go for it. Absolutely.
So great. That like adds on to like kind of like clinical autonomy. It just like, I don't know. I feel like just gives you the opportunity to grow yourself and just be exactly what you want to be.
Yeah. And I told myself when I started here, I said, I want, and that's just something like absolutely detrimental to my practice. I want to wait at least like 2 months to try the materials that we already have here in the office. Because like I just mentioned, there's a lot that you don't have experience with, you've never tried before. So you can't say that it's not going to work for you. I think after 3.5 months now, I've started to get a better feel for the stuff that I like and the stuff that I don't like. So I can have more knowledge in making that switch and more confidently know that I'm making a switch away from material I don't like to something I do like more. But we do absolutely have autonomy in what we want to use.
Definitely. That's awesome. So this is going to be the last question from all of us. And
Sure.
then I can ask if you have any, closing remarks or anything like that. But what are you enjoying about dentistry?
What am I enjoying about dentistry? There's so much. It really is. Um, as opposed to being in dental school, I've loved the work-life balance. I love the patient pool that I work with. I work in a population that is very grateful to have the treatment that they have. And I think that the people that come in to see me can tell that I am there to serve them. And I come in with a smile. I do my best every single day to come in with a big old smile on my face, because you have to understand, as a dentist, you're gonna have a lot of people that come in and the very first thing you hear is, I hate going to the dentist, right? It's just reality. People say that every single day. I hear it every single day. But I do my very best to make them feel comfortable, make them feel like they're heard, because a lot of people don't feel like they are heard. Their concerns, their fears, their desires when they go to the dentist. So I always make sure to, whenever somebody has any of those, they express those to me, that I can repeat those back to them so they know that they're being heard. I love seeing someone who is nervous, who is scared of the dentist, who has obviously had many years of dental neglect, who has significant needs, getting their oral health turned around, and seeing an end result, and really surprising them. We had an excellent case of this come through last week. This poor patient hadn't been to the office, or hadn't been to a dentist in a very long time, and very severe periodontitis. And she was scared. And we ended up doing extractions, a pretty significant number of extractions with an immediate denture insert. And she was scared when she came in the day to get her teeth taken out. And when she left, when she came back the next day, I should say, for her 24-hour recall, she had such a smile on her face, because we really surprised her with how well the procedure went. I told her, like, look, we're going to take great care of you. I understand you're nervous. It's completely natural to be nervous, but we're going to take great care of you. We're going to make sure that this goes smoothly for you. And we're going to make sure that your post-care after today's procedure and moving forward goes smoothly. And she was like, you were right. It surprised me how smooth the process was. The denture is great. Of course, every denture needs adjustment. So I'm not saying that the denture was perfect on day one, because they never are. But because we set her up with realistic expectations of what she should be expecting, because we made clear to her that we heard all of her concerns and we understood her fears, and we're going to support you through all those and make sure that you come out with a good result on the other side. I love seeing those success stories. That is great fun to me. I love working with the people that I work with. We have a great team that we've assembled over the past few months. We've been having a lot of fun. 2 great hygienists, 4, sometimes 5. We have somebody that works part-time as a dental assistant. We have an office manager that's really dedicated, a great front desk team, and then our team of rotating docs. So it's really fun coming to work with everybody, having some good laughs. Right now, I feel like from a social perspective, of course, it's a little bit different because of coronavirus. We're trying to maintain social distancing because it's so important for us to keep this office running for our patients. So that means at lunchtime, which is normally the social hour, right? Everybody's got to keep their space. But we find ways around that. We've been having a lot of fun with it. I love the autonomy. I love the challenges of going in there every day and knowing that I've got to give it my 110% in order to give the patient the best experience possible. I love the work-life balance that I feel both dentistry and Aspen have helped create for me, or have helped me create for myself, I guess. Really, really loving it. I feel like I've had more time to be able to do the personal things that I want to than I ever did in dental school, and more opportunities to do things I've always really wanted to do. I feel very, very blessed for those things. And so it's been fun. Everything about it, the personal, person to person, whether it be person to office staff, or me with my patients, professional being challenged and learning every day, but personal life, being able to do things outside of work I've always wanted to do. It's been an excellent experience so far.
Wonderful. That's so good to hear. That's an amazing answer. So we're we're at the end of the hour at 9 o'clock now. So I just wanted to thank everyone that attended and a huge thanks to you, Dr. Brown, for answering all of these questions. I don't know if you have anything else you wanted to add, but if not, we can totally wrap up.
I have one thing I would
Yeah.
like to add. And this is something I told a lot of younger, when I was a fourth year student, particularly, I wasn't until I was a fourth year student that I would say this to people. I felt like when I was a first, second, third, and especially like even my fourth year of dental school, I felt like I didn't have anybody to ask what I felt like were stupid questions to, because I felt like I had a lot of stupid questions all the time. I felt like I found a couple people, particularly like when I was a second year and just coming into the clinic. He was a really nice fourth year and he was never judgmental. But then once he graduated, I never felt like I had somebody like, hey, this feels like a really stupid question. And I'm so embarrassed to ask this to anybody that I would put off asking anybody that question. And what I would say is there's a lot of people, I know this is a cliche and probably you've all heard it, but if you have the question, there's probably somebody else that has the question. And so I would tell first, second, and third year students, particularly as I was starting to wind up my fourth year, if you have any questions that you feel like are too stupid to ask, first of all, they're probably not that stupid. Second of all, come talk to me. Come ask me, because I'm sure that I had every one of those questions plus 10 that you feel like you had. And I'm not going to judge you, because this is a complex field. It's a challenging field. It is something that you're going to struggle with for a period of time. I want everybody to know, like, there's going to be good times, there's going to be hard times for sure. And so if you feel like you have any of those questions that you feel too stupid to ask anybody else, don't be. You can always reach out to me. My email address is very simple. Ready for it? Andrew.brown@aspendental.com. Again, that's just really simple. My name, Andrew.brown@aspendental.com. I'll be happy to chat with you. I don't want you to feel like you don't have anybody to ask a stupid question, what you feel like is a stupid question to, because there are no stupid questions in this field. I genuinely feel like it's a complex stuff, but it's fun when you start to feel like you're getting the pieces put together. It can become fun. So if you have any questions, whether you feel like it's silly or not, give me a holler on the email line. I check that email every day, and I'll be happy to answer for you. So it's been fun. It's been thanks for inviting me to do an AMA.
Yeah, wonderful. Thank you so much for volunteering. And like Dr. Brown said, feel free to contact him, and thank you for giving your contact information out. And if you have any interest in shadowing, we can arrange that too. He's on the west side of the state. It might be a little far for Detroit Mercy and Ann Arbor students, but if you can make the way out there, why not?
Are these just? I know it's kind of funny to ask right at the end of the hour, but we have Detroit Mercy and University of Michigan students listening in right now?
Yep, those are the two. Mm-hmm.
Oh, okay.
Yeah.
Yes. So I went to University of Michigan, class of 2020. So maybe I've met some of you. I don't know who's all in on the call. But yes, I spent 4 years in Ann Arbor. And now I'm over here in Muskegon, Michigan, or I practice in Muskegon. So about 2.5 hours from Ann Arbor. You're welcome to come on out.
Wonderful. Thank you for that offer. And again, thank you for attending, everyone. And thank you again, Dr. Brown, for hosting this. Thanks.
Have a great night.
Have a good night, everyone.